My name is Dr. Philippe Deprez. I am a Belgian doctor living in Spain. And I am a little bit specialized in chemical peeling, as you might know. So I will present to you this new peeling. Phen Very Light is really a totally new, it's a little bit fringe peeling because it's a new formula, it's something that doesn't exist on the market actually. Something that I made, that I formulated for having quite a deep effect, depending also on the number of coats that you can apply on the patient. It is a big principle in skin tech. In skin tech, we don't work by concentrations. We have a fixed concentration, but the more coats you apply and the deeper you go, what gives much more security to the peeling, because you are the chief of, you decide what you do. You put one coat, you see what you have, and you decide if you go for the next coat. If you use the other technique of increasing the concentration of the acids decides for you. Let's imagine you use a 35% TCA peeling, which is dangerous, don't do it. You apply on the skin. If you have a thick skin, it will be good, very good result. If you have normal skin, you will have many problems. And if you have a thin skin, you will burn the skin with one coat. So you don't decide in this case. If you use, at the contrary, the easy TCA or easy TCA pen control, you apply one coat on any kind of skin and you look. You let it penetrate a few minutes, you look what you have, and you decide, oh, I have no effect, so I will put another coat, and so on. You put the number of coats that you consider necessary for getting the result. So you are in total security. We had not this total security that we could achieve with the TCA. We had not it with the phenol peels, because we only had on the market 30 years ago, it was only the Baker-Gordon formula. But the Baker-Gordon formula, you know that it's an unstable formula. You have to mix the product and then mix it, shake it all the time for maintaining the pseudo solution in a good way. But you never knew when you put your cotton bud inside of this solution what phase you put on the skin. You could put the oily phase or the water phase of this pseudo solution, and you had differences of result. More, the Baker-Gordon was very melanotoxical. It means that it gave to the patient a skin the color of how do you say that, tablier blues and this. My shirt, washed with Perlan. So this was a big problem. After that came other formulas, the ether formula, but it's the same problem. So we had not really phenol that could be good for the skin. Then came the lipenylate formula 25 years ago. It was already the first oily phenol, not a phenol in water and alcohol solution. It is an oily phenol with the property not to give this whitening, this blanching of the skin. So we never had in 25 years of use any doctor complaining that I apply this product on my patient and now the skin is totally white. The porcelain syndrome, it doesn't exist anymore with the lipenylate. So this was already one problem solved. Lipenylate, anyhow, it's a peeling containing 63% of phenol and croton oil. So it's something very deep. It goes to the deep reticular dermis. We need something light. So I made the Phen Light for solving this problem. With the Phen Light, we have 30% phenol, also croton oil, a little bit TCA. And with this, we can already go less deep. So for lipenylate, we need a surgical area for doing that. For Phen Light, we can do it as an office procedure, but it goes to it goes as deep as the limit between the papillary and the reticular dermis. So it's quite a deep peeling anyhow. But it can be done without pain. Also, it is already with a little pain, but not really something always tolerable without anesthesia. And as an office procedure. Nevertheless, it was anyway, it is still quite a strong peeling, less than the lipenylate, but quite a strong, the Phen Light. So it was missing something between the simple TCA peel and the Phen Light, and this thing that was missing is the Phen Very Light. Why did I say that it's a fringe peeling? So not only for the formulation, it is phenol, TCA and croton oil, but that's a peeling that goes to the papillary dermis, easily to the papillary dermis, without any frosting. That is very strange, because usually a peeling that goes to the papillary dermis gives a frosting of the skin proteins. Here we have no frosting. And more strange, we have absolutely no pain. So that's something very interesting, because we can go deep into the skin without pain and without frosting. The without frosting is a little bit tricky, because we are used to control the depth of the peeling by looking the frosting we have. In this case, we cannot see the frosting because there is no frosting. Why is it no frosting? Not because it is less efficient, but only because the frosting comes from a proteocoagulation, and the erythema comes from vasodilation. And in this case, the vasodilation is so quick that it neutralizes the frosting. So the frosting exists, but is wiped out immediately by the edema and by the erythema. So we don't see it. Nearly we don't see it. So how do we control the depth of this peeling? That's finally very simple. We go by coats. It's the only peeling of skin tech in which we calculate the number of coats we apply. On other peelings, we never think like that. On this one, yes. So we apply one coat, we go to the Grens zone, usually. 2 coats, we enter inside of the papillary dermis. Now, if we put 3 coats of this product, we go close to the border between papillary and reticulary dermis. So 1 coat, it's a quite light peeling. The people I will show you later, people will not peel a lot. 2 coats, they will peel quite a lot, and 3 coats, they will peel really much. And all this without pain. What are the indications of this peeling? The main indication I see for this peeling is not the pigmentation. It will work on pigmentation if you put enough product. If you put 2 coats, 3 coats, you will work well on pigmentation. But the most interesting part of this peeling is that with 1 or 2 coats, you have a very nice tensing effect. You have an anti-aging and retensing effect, which is absolutely visible after already the first peeling. You can make 2 peelings, 3 peelings of this once every 15 days. So you can repeat this one. This is the only phenol that you can repeat so quickly. So we will say indication is most important is the anti-aging with tensing effect. It will not give you the effect of a surgical facelifting. We agree about that. But it will give a better, much better skin tension, a much better skin quality. It will remove quite easily lentiginous. About melasma, if melasma is superficial, it will be removed. If it is deep, you will need several sessions for treating that. Also, another advantage of this peeling is that it is CE certified. So all the peelings of skin tech are CE certified. Phen Very Light, Phen Light, Lip and Eyelid. They have a CE, medical CE. It means a class 2A, a CE with 4 numbers. I remind you that if you see a CE on a medical device, CE without numbers following the CE, it is not a medical CE. If you look on the teddy bear of your child teddy bear, you will see a CE like that, CE without number. So it is not that. So CE with 4 numbers, it is medical. The 4 numbers representing the number of the notified body, the external authority controlling your products. So, okay, so these are biopsies in the control group. With glycolic acid, we see not much. With 30% TCA, we see much more fibers here. With 50% TCA also, and with phenol, we see a dramatic increase of everything. So if we look the histological studies, we can see a very big difference between collagen and elastin fibers organization between glycolic acid, TCA, and phenol. That's well known. So coming back to practically. So that's the way the patient peel after 2 coats of Phen Very Light. So we are speaking about quite a deep peeling, as you can see. It is not yet a desquamation of papillary dermis peel, a deep papillary dermis peel, but it goes to nearly the deep papillary dermis peel. So this is the way. You see, the skin is wrinkled because it has been an edema. The skin is wrinkled, the skin is swollen. So you can see here also a yellowish thing. What is this? That's the powder, the bismuth subgalate powder that we apply on the skin if we apply more than 2 coats and more. For 1 coat, no need of this powder. So this powder is something the patient do not like. But imagine, with or without powder, anyhow, when you put 2 coats or 3 coats, the patient is out for 1 week. Because when you do a deep peeling, the patient is out for 1 week. This can be at day 2, this can be at day 3 or 4. You see, edema already disappears, the skin goes peeling, deeply peeling. And that's the result you can have just at 1 week. So it was like this before. You see the structure of the skin. You see now how is the structure of the skin. Evidently here you see much more the veins, because the veins were hidden by the wrinkles in this place. But you can also see how better the tension is around the eyes, and she has much less wrinkles. So for the quality of the skin, the tension of the skin, even this little simple peeling is good. You see, on the lips also, on the forehead, it's much better. Recommendation: combine this peeling with the botulinum toxin injection, evidently. So before doing any phenol peel, light, very light, or deep phenol peel, it's always recommended to apply a Botox, to inject botulinum toxin from 8 days to 1 day before the peeling. So it should not be obligatorily 1 month before. It can be just the day before. And if you forget, the week after, because sometimes we do not think to everything and we forget, so you can do it the week after. See, desquamation and the results. So, about desquamation, this is typically how the desquamation appears after 1 coat of Easy Phen Very Light. So you can see that it is very easy. It's very easy desquamation. A man can shave, no problem with this, and even is better because when you shave, you put a cream for shaving or something like that, and with the razor, you take off this desquamation. If you apply just 1 coat of Easy Phen Very Light, you can have a shower the same day, eventually, the same evening, you can begin to have showers. So you can have you can live totally normally, except that you will have this kind of desquamation during 3 or 4 days. Shaving, washing the face, no problem. You see, this is another kind of desquamation on the forehead after 1 coat. So that's the grand zone peeling. Now, mistakes you can make. Yes, because in this case, the Easy Phen Very Light was used by a doctor for treating acne scars. You will not treat acne scars with Easy Phen Very Light. It's from far not deep enough. For treating acne scars, you have to use a deep phenol peel. You have to use the lip and eyelid formula. This will maybe treat that. Or if the deep phenol peel is not enough for treating that, then you have to go to the chemoabrasion. The chemoabrasion is a fantastic method which is able to remove all the acne scars in maybe 1, maybe 2, maybe 3 sessions. We don't know. It depends on how deep were the acne scars, but it removes it without phenol. It is chemoabrasion. It is a technique using a sandpaper abrasion immediately before applying the easy TCA. Don't do it with another TCA. The easy TCA is needed after abrasion. If you use another TCA, you have to make reverse. Apply the TCA and make abrasion after. But you have from far not the same results. So we'll follow one other patient. So this patient, she had a big sagging. She had a lot of fat on this area. She was feeling aging. So I did 2 things to her. So since she had too much fat on the cheeks, I injected RRS-HA Cellutrix, which is another medical device able to treat the cellulitis very well. But you can also inject it in the face for slimming the face without any danger. So you use a cannula, 25G cannula, 1 point, and you inject retro-injection like this, and another one, injection like this. 10 milliliter by site. 10 milliliters. So when the patient goes out of your clinic, she has cheeks like that. But after a few days, it's already much better. You see at day 2, she had, and after that, immediately after that, I applied to her 2 coats of Easy Phen Very Light. So you have seen, you remember, one coat is peeling like that. 2 coats, it's peeling like this at day 2. So it is much stronger already, 2 coats. You imagine 3 coats, what it will give. It will give very deep peeling. But anyhow, as you can see, thanks to the combination of both, we already have much less sagging and much less fat on this area. At day 3, you see she's still peeling. She begins to peel, excuse me. The skin looks to be brown. This is not a hyperpigmentation. I show you on purpose this slide because some people seeing this will say, oh my God, it's a post-inflammatory hyperpigmentation. It is not. At day 3, you have no post-inflammatory hyperpigmentation. Maybe at day 8 or 10, 15, you will have maybe hyperpigmentation. But at day 3, impossible. You have to give time to the melanocyte to produce melanin at least. So this is not an hyperpigmentation. It is only the skin which is dry on some places. So now, you see, nothing is simple. This lady, as you see, is a lady working in a laboratory. You see here, it is a lab. And she's working in my lab, in fact. And she was involved, I was not informed about that, but the guy who is making the program involved her in the production of phenol peels at day 3. So this day, she was just going out of production of phenol peeling. So she had some vapors of phenol touching the skin, which was quite uncomfortable for her. And we put the bismuth subgallate powder in this case. And she said, with bismuth subgallate powder at day 4, all the irritation caused by the vapors of phenol that I had on day 3, it disappeared immediately. It's very comfortable. So it's not nice, but it's comfortable and extremely protecting, because this bismuth subgallate powder is an antiseptic, very strong antiseptic, and it speeds up the healing, the skin healing. So when you put it, the skin heals faster. And so this is day 4. We will see the patient at day 5. You see already day 5 much better. Let's come back. You see day 3, she was irritated due to the phenol vapors. Day 4, we apply bismuth subgallate. Day 5, it's already much better. And you see also the result of Celetrix begins to be much better. You see how it peels. That's a peeling. That's a papillary dermis, nearly papillary dermis peeling. See all the skin here going away. Okay, and this is day 9. So day 9, she still had a little bit redness, but nothing important. But so she was like that before. She was a picture before the peeling, and that's the picture at day 9 after one peeling. 2 coats of Easy Phen Very Light. We could also make it better at the lips. You see, so the quality of the skin, everything was much better on this patient. So it gives really a very interesting effect on skin aging and effect on skin renewing. What is very important, much more important than the way to apply the peeling, you will see the way to apply your peeling has to be strict. I will explain you with the patient just in 2 minutes. But what is very important is the pre-peel and the post-peel care, because we are doing a deep peel. So we have to follow up the patient. We have to give the patient the right product at the right time. So this is here, Easy Phen Very Light. That's the day of the peeling, day 0. Day 0, we apply the peeling. We apply the post-peel mask. I will show you what it is. It's a little tube, cream tube, which is inside of the kit. And the post-peel mask, like Vicky is showing to you. So, day 1, the patient, day 0, the patient applies the rest of the post-peel mask that we give. So the post-peel mask is this tube that makes that has an anti-inflammatory activity, so it removes the inflammation. But what is important, it is 3 weeks before. if we think that the patient has any risk of hyperpigmentation 3 weeks before, we have to give the patient a cream named blending bleaching. Blending bleaching. This one. Blending bleaching. And Aclarance. Aclarance is another one. It's a new cream. So what's the difference between blending bleaching and Aclarance? So they are both creams for suppressing the synthesis of melanin. But the blending bleaching is suppressing the synthesis and also has an anti-inflammatory activity, which is very interesting after peeling. So suppressing the synthesis and anti-inflammatory. When the Aclarance, it is much more anti-inflammatory, or much more anti-tyrosinase, but less anti-inflammatory. So by combining both, we have different ingredients used in both creams that have a synergetic action. So we will use the Aclarance in the morning because it's a serum. It allows makeup very easily. So Aclarance in the morning and blending bleaching in the evening every day during the 3 weeks before the peeling. So it will calm down the melanocytes and you will have less reaction to the sun. I call this a melanocyte sedation. So quiet. At the same time, we have to add a sun protection. Well, in London, I don't know. Visibly, I don't know. But if there is any kind of sun appearing, the patient has to wear a sun protection, which is Melablock HSP 50+. Because evidently melanocytes are stimulated by the UVs. So you have to suppress the stimulation, so they will not be stimulated by the UVs, and you suppress the synthesis, so you will come to the peeling with a very quiet melanocyte area. So this day you make the peeling, and the box of peeling is made for one patient. So you apply the solution, and then you apply the post-peel mask. The post-peel mask, this one, at the end of the peeling. But the post-peel mask is 10 grams. It's much too much. At the end of the peeling, you will maybe put 3 grams or 4 grams on the skin, so you still have 6 or 7 grams left in the tube. You give it to the patient, and the patient applies it herself on the skin during the first day after the peeling. So you have a permanent anti-inflammatory action for avoiding problems. At day one, if you apply more than 1 coat, you have to see the patient again. You have to control the patient. So 1 coat, send the patient home, nothing will happen. 2 coats or 3 coats, it is deeper. So you have to see the patient at day 1 for control. And if you see that the skin is wet, then apply bismuth subgallate powder, this little packet with yellow powder. So if the skin is wet at day 1, you apply the powder. If the skin is not wet, you don't apply the powder. If you want to spare 1 day, 1 visit of consultation, you can do like this. You know that after 2 coats and 3 coats, it's a high probability to have a wet skin at day 1. So apply directly bismuth subgallate, so the day 1 you say to the patient, stay at home, and you know that she's protected by the bismuth subgallate. Okay. After that, it's very simple. Day 2, day 3, day 4, day 5, there is nothing to do. Absolutely nothing. Eventually, have a contact by WhatsApp with your patient to see how she is and if she has problems. But the patient has to know that she can contact you anytime. With any phenol-containing peeling, you have to give your personal mobile phone number to the patient, so she will be able to contact you. And believe me, they don't contact for nothing. I'm used to do that since, I don't know, for 30 years. I give my personal mobile phone. They don't contact if not needed. Day 6, in case we have yellow screen, we have yellow powder, we have to apply Vaseline for making this yellow powder to get out. And day 7, the patient should be good. We check the patient. The makeup is allowed if the skin looks good. So from day 7, makeup. What kind of makeup? So it depends if the patient is red or not. So it depends what the patient has to do. If the patient is red, which is only possible after 3 coats, then give, I don't know if you have this. You have couvrance. Couvrance, it is couvrance makeup. You have not? No. maybe a few hours. So you have a very covering makeup, something very covering the color. So then after that comes protective home care. Day 8 to 15. So we are here day 7, then 8 to 15. The patient should cleanse the skin with the Skin Tech cleanser. So the Skin Tech cleanser is a cleanser, a foam, with a pH 5.5. So it regularizes the pH of the skin. Regularizing the pH of the skin, you also avoid to have infections, and you make it heal faster. If the patient has any kind of erythema, apply the cream Ipilase. So the Ipilase is a cream that I formulated for reducing the erythema after lasers and IPL, intense pulse light. You have often erythema. If you use this cream, it will reduce the erythema in few days. So it has been done a study about that Ipilase reduces the erythema post-laser in few days, the same as other cream make in few weeks. So it is a very strong one. And use the Melablock for protecting against the sun. So Melablock, how to use the sun protection, except in London, at 9, at 12, and at 3 p.m. 3 times a day, so it's during summer mainly. And after that, after day 15, then we go to specific home care. Specific home care, what is it? It is continue, go on washing the skin, cleansing the skin with the Skin Tech cleanser. Use Melablock if there is sun, and if you have any pigment risk, then you go on with the blending bleaching and the Acclarence. Don't apply blending bleaching during the first week after, because it's burning the skin. There is one cream that doesn't burn immediately after. The name is Night Intensive Repair. It's an aesthetic dermal cream. It is Night Intensive Repair. The H, Night Intensive Repair, H for hyaluronic acid. It's a cream with a serum with hyaluronic acid, and this one is not burning after the peelings. Okay? If you want, you can repeat it after 2 weeks or 3 weeks, depending. If you put 1 coat after 2 weeks, if you put 2-3 coats after 3 weeks, you can repeat this peeling. So finally, it is quite a simple treatment. And you will see. Now I will apply one easy Phen Very Light, and you will see how simple it is. Let's come to our patient. So she has the cleanser. I will see if the skin is dry. Yes. Yes. Okay. So the cleanser, you apply it, but you don't need to rinse it. You just apply it, you let it on the skin, you do not rinse. Do we have it? Okay. Because it only contains surfactants, and the surfactants, what it will make the peeling to go more uniform finally. So for applying easy Phen Very Light, first I will divide the face in 5 areas. That's the first area, centrofrontal. The next one is from external tragus to canthus, external canthus to tragus, excuse me. And then from here, I will follow the nasolabial folds. And on the other side, also external canthus to tragus. So by this way, I have 1, 2, 3, 4, and 5 areas. We divide in 5 areas because I would like that we wait 5 minutes between 2 areas. For let's say it is in the book for toxicological reason, because we need to give time to the phenol to be detoxified. No, it's in the book, but you can go faster than what's in the book, because if you calculate the quantity of phenol we have here, it's a 15% phenol peel. It means that in 3 milliliters, you have 450 milligrams of phenol. And for having any cardiotoxicity, you need to have 1 gram, 1000 milligram circulating in the blood in one moment, one given moment. So you cannot have 1000 milligram on the blood if you apply 450 milligram outside on the skin. It's totally toxicologically impossible. But we try anyhow to give, we will divide the time. We have 25 minutes, 5 areas, so we try to rest some 2-3 minutes between 2 areas. So we have to remove the cap like this, so the cap is removed. Put it back. Okay. And then, very simply, so we make no anesthesia, we don't need, we will apply the product on the first area. So we have to take the product from the bottle, then we spin it dry once or twice on the neck, and then we will apply on the patient's skin. So, miss, you will feel a slight burning sensation for 12 or 15 seconds maximum. It will not be strong. Look, this is what you will get. So you see, application is done by using circle movement. You go up to the limit, and you come back by the same way to the center. You see already an erythema, yes? And at the end we treat eyelids. No problem for going inside of the eyebrows. It's not toxical for hair. I put a lot on myself, as you see. So, could we have maybe a zoom on the forehead to show the erythema coming immediately? You see edema coming. You see the edema coming immediately and erythema. That's the effect we have. Okay, is it painful?
No, not really.
Not yet. Finished, yeah?
Quite down.
Okay. All right. So that's our first coat. So if would we apply a second coat, we would apply a second coat now. And then we would apply the third coat if needed. So we apply area by area. 1 coat, 2 coat, 3 coats. It means that before beginning the peeling, we have to decide, this patient, she has very sun-damaged skin, so I will need 3 coats. So you apply 1 coat, then you take product, 2 coat, you take product, 3 coats. Yeah, always round circles, and you go and come back, right? So in this case, we decided with the patient not to make her peel too much, but you can see that she has a very strong and uniform erythema on this area that we treated. Okay, maybe on the eyelids it was burning a little bit more, no? Not that much, okay. Okay, so I will take product. Because it's also a different in toxicity if you put 1 coat, 2 coat, 3 coat. If you put 3 coats, you will put 450 milligrams. If you put 1 coat only, you will put maybe 200 milligrams. It's nothing. It's no reason to be afraid about toxicity. Right. Second coat. The second area. You see always circle movements. Except when you come to the eyes. Open your eyes, please. Here you have to put up to 1 millimeter of eyelashes. Close your eyes. And then you go back. You go back on by the same way. So you just moist your cotton bud once. What I'm doing here is very bad indeed. It's because I have not a correct table for putting my phenol. Normally you have to take the product. Maybe you can put this closer to me. So the best way, the good way to do is to take the product, spin it dry, and put the product on the table for avoiding any risk. I know what I'm doing. No, but it is not good. So you see the erythema and edema we have on this area. It is really immediate reaction, right? It's okay. Painful.
On the jawline, it was a little bit. Absolutely fine.
And now?
No, I can't feel nothing now. It's calmed down.
It calmed down. Yeah. Okay, so. round circles. I go to the lip. If we apply on the lip, it's absolutely not a problem. You know, the lip is, I will apply on the lip. Oop, it will be better for the lip. And the nose. The nose is important and very thick, so I will take more product, a little bit more product for the nose. And the nose is difficult to make round movements, but okay. Right, so I made one pass here, so I have to go back by the same way to make my two coats. And it's not two coats, it's my first coat, but the go and come back. You see edema coming on all this area. Now we'll go to the other side. So do you have some questions? We will rest a little bit the patient. Some question about that. So I will ask the patient. So if you would qualify the pain, would it be a strong pain, a medium pain, a light pain?
Medium. So on a scale of sort of 1 to 10, 10 being the highest, around about 7.
So
7.
At the moment we apply the peeling, yes?
Yeah.
But now?
Now can't feel nothing, so 0.
Now it's 0. So the pain is really something like, we would say, you would be agree with 10, 15 seconds?
Yeah.
Yes? Okay. So 10, 15 seconds of pain. And, well, it is a pain that doesn't make the patient cry, that this doesn't make the patient move the feet. You know, the pain, when you see that the patient move the feet, it is really, really painful. If she vomits also. Excuse me. Okay, so we have now to go. Well, we usually for not forgetting no place, we go from here, and we go here. I make it because I am in UK. Usually in Europe I go like this, on the other side. But I make a special presentation for UK, going to the other side. And more, it is true. So we go. Open your eyes. Close your eyes. And by using this technique, you know, take the product directly from the bottle, spin it dry on the neck of the little container, on the little bottle. There is no risk to put phenol in the eyes, because this would be the worst that could happen during a phenol peel. It is to drop phenol in the eyes, because phenol, as you know, is a strong proteocoagulating product, and if you drop phenol in the eyes, you coagulate cornea, which is a very bad trip. Coagulating cornea, nah, it never happened. As long as I know, but it's a theoretical problem. So always use half-dry cotton buds, and don't use big cotton buds, because if you use a big cotton buds, you put a lot of product inside, and it can drop. It can run on the neck, etc. Here, the way to do it doesn't allow nothing to run into the eyes, nothing to run into the skin, into the neck. See, she's red. Huh? She's well red. Still red here. Now, oops, I will wait 2 minutes. I lost my thing. And I will apply already a little bit of post-peel mask on the forehead. Well, a little bit, a big bit, not a little bit. For the post-peel mask, this will relieve the erythema. So the post-peel mask is the end of the peeling. So we do not neutralize anything. We do not wash. We do not neutralize anything. We just apply the post-peel mask. We apply the post-peel mask on this half. And post-peel mask will really lower the intensity of erythema. Not of pain, because it's not painful now, but of erythema. Okay. So I only need, where is my cotton bud? No, I had two here. Okay. Now, also, you know, here we still have, if you look on the bottle, can you make a zoom on this bottle? I don't know how to show it better. Yes, you see on the bottle. You still have a lot of products into the bottle. So inside of the bottle we have 450 milligrams, but still here I still have 300. The bottle is made for 3 coats. So if you program to make or to apply only 1 coat of on the patient, what you should do maybe it is to syringe out 1 milliliter out of this, you put it in a little container and you work on this. This way the rest of your bottle would be still valid for using. Because if you open it like I do, the rest here you can't apply because it's contaminated finally. It's contaminated by the germs of the skin germs of the patient, but contaminated. Okay. So shall we with this remove acne scars? So we will not remove acne scars with 1 coat. Could we make it disappear with more coats? Maybe with 3 coats it would be much better, but make it disappear, I don't believe. Because even deep phenol peel or not always well. For these little scars, yes, but the deeper scars would not. Okay, so the last one. Round. You see, the most important is what I am doing now. Round circles until the limit we decided, and then we come back. You see that I never remove my cotton bud out of the skin. I always let it in contact with the skin. Right? And you see, surprisingly, here we see a frosting. Can the camera show the frosting here? Yes, you see? Oh, just here, that. You see, we have a little frosting. Why? Because on this area we have frosting. So she will maybe peel a little bit deeper here, but the frosting, you will see in 2 minutes there is no more frosting. There is no more frosting. Right, so I put my coat. Now I will apply post-peel mask here. But I think I did not put on the eyelids. I think I skipped the eyelids here. I have to put on eyelids. Okay, burning a little bit, sorry. So, like this, when I will have applied the post-peel mask, it will be finished. Now, what is doing post-peel mask? Can you make it up a little bit like this? Can you show the forehead now? This area, forehead. You see the area with post-peel mask and the area without post-peel mask. Here, erythema, not completely, but is much lower than on the other side. So with post-peel mask, we reduce inflammation in a very important way. It is a very strong reduction of inflammation. And we know that the problem of peelings is inflammation, because inflammation, post-peel inflammation, is responsible of, if this inflammation is self-maintained, by itself it enters in a vicious circle, self-maintained, it will stimulate everything. It will stimulate the risk of scarring, it will stimulate the risk of pigmentation, the most important here. So if we self-maintain an inflammation, we have more risk of post-inflammatory hyperpigmentation. By cutting the inflammation immediately after the peel, we stop the unnecessary inflammation, and we have much less risk of post-inflammatory hyperpigmentation. Please light on again. Right, so now I will apply again post-peel mask. Where is it? Thank you. I apply a big coat of post-peel mask. So in the case of one coat, it is not necessary to give the post-peel mask to the patient, because with one coat of post-peel mask is more than sufficient. So you keep the rest of your post-peel mask for the rest of your peeling solution for our next patient. How is it painful now?
Fine, I can't feel nothing.
Feel nothing, no?
Feel nothing.
Feel absolutely nothing. So very good. And that's it.
Use it on the neck and décolleté as well.
You can use on neck and décolleté as well. Yes, 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 sure. Yes. Yeah. I use up to easy Phen Light on neck and décolleté. Yes. Okay. If there is no more question, thank you very much for coming. Thank you. Thank you.